Primarily, what we do is we take people who've been injured. So our usual first point of contact with a patient is in or through the emergency room. But people get injured badly and have multiple broken bones, come into the trauma center, and we evaluate them in the emergency room, and if they need to go to the operating room, that's our primary function, is surgeons putting people back together again. I did my trauma fellowship and I loved it, and it's very much my personality. I gravitated to it without thinking about it. In a simplistic way, I like to see something that I can fix. I'd been at Parkland up in Dallas for quite some time, and Austin at that time, so that's in 2002, was just hitting its stride as far as growth. I mean, it's so big now, but it wasn't then. And they didn't have anyone here doing trauma. Now, there was not a single trauma-trained physician, orthopedic surgeon in town. And one of my fellow residents, he was a couple years ahead of me, had been approached by people down here to come help. And he didn't want to do it by himself. And so we came down and started, through Texas Orthopedics actually, interestingly, at that time, started a practice that was solely trauma. And since then we grew. We've had other people join us we were a 4-person group that have since joined Texas Orthopedics about a year ago. So we came back into the fold. Having been a trauma patient, and literally having been operated on by my partners, it's helpful taking care of people who've been through the same thing, because I can now relate to them, not just professionally, but emotionally. So they trust not just your professional opinion, but when you tell them that, hey, you're going to get better, I did the same thing, I think there's more belief. People like to know that someone else has been through this, and it's going to be okay.